Thank you so much, Alexandra. I really always appreciate you sharing your gifts with us. And I will share with you that I particularly needed that today because I think that like many of us, we're in the like back to school mode of getting our kids back to school and ready. And then those of us in academia are welcoming new students. And while, we center the research that we're doing in this area on gun violence, it's very easy to just like keep on going and focus on the outcomes without taking a moment to feel. And your words and your music always help me connect and feel. So thank you so much.
Muchas gracias.
Alexandra, I'm wondering, you've been such a key part of bringing the community together and making some links between the families, the all the young people that you named and the families that are mourning, and Line 19 and Iglesia La Semilla, and us at the School of Nursing, doing research, trying to support advocacy around this. So I'm wondering if you can just spend a few minutes walking us through the history of what the experience has been in our community with loss around gun violence and how we started this project.
Muchas gracias. Personalmente, I guess I'll say it in English. Personally, this touched me because my child went to school with some of the victims, and she also first told me about in 2021 we lost Miguelito Cruz, and that was a devastating situation. My daughter personally remembers seeing him the very last day, and they were at the field, the soccer field, and he was leaving, and he wanted to say goodbye to her, and he came up and he wanted to hug her, and she was just saying like, go away, go away. Going that those words, go away, they really harmed her, like in the sense that when she learned that he had been a victim of gun violence that same night, um she was she went through a really hard time. And as a mother, I didn't know what to do in terms of holding space for my daughter, um understanding that Miguelito was her same age. He was a young man who loved sports and was very loving, and his mom, I've gotten to interact with the families, just the way you want to interact with the families of the kids that your children are related to or connected to. And so this is very personal to me. Actually, this work, it doesn't fit within a framework of deliverables or metrics that people want to see, because actually those deliverables or metrics are not real. They're not real to the families. And that's what I love about this project and working with Doctora Rosa. Like, she understands, like, this is not something that is going to fit within a nicely, box, like the way people want to see it in boxes. This is real life. This is, these are all young people that are gone from us too soon, too early, and their factors and the stories that are being told about them sometimes are not the right stories. I've had to talk with families who say that the stereotypes are that these kids are niños de la calle, and that's the farthest from the truth. We interact with these families, Doctora Rosa, Norma, Allison, Patricia, all of us who, Fanny, like all of us who are engaged in this project understand that these families have been impacted in ways that words can never tell. And the last thing that they need is for stereotypes, to be heard that, these kids had it coming, or a lot of harmful things. And so I've had to hold space with these families because the reality is that my children are children of Durham Public Schools, and I have been an advocate for Durham Public Schools for a long time. But this is something that there isn't a way for me to say that I'm immune to any kind of crisis, especially here in Durham, especially with the gun violence rates. So in reality, I put myself in those shoes, and I tell those moms that, I don't judge anything of what happened, because that could have been me. I think that is part of the important thing of this project, that we're not approaching as though we have the answers or we have the solutions, or that we know better, or that we could have done anything differently. In reality, we're holding space for families who had the worst thing happen to them, who didn't deserve it. And you know, I just feel like this is an honor for me to be here in this space and to share, um, to know that my daughter, my children are directly impacted by this. And I feel like holding space and doing this work is part of like what I have to do as a mother, you know, in terms of understanding this. And I'm so honored again to work with Dr. Rosa, Allison, Norma, um, the people who understand that this is going to take some time. This project is going to happen at the pace that families want to engage, and we're going to be holding space for them primarily, and understanding that we're all in this together. Gracias.
Thank you so much, Alexandra. Um, you know, about a little over a year ago, there was a convening that many of you attended, which was I think it was one of the convenings that we were trying to bring different members of our community together to really talk about gun violence as a public health crisis. Alexandra, Iglesia La Semilla, I think Latin 19, sort of independently had been trying to support families, and participate in vigils and in convenings trying to bring attention to this. But in that forum that we had, I think it was in July, um, Alexandra, along with Pastor Vergara, got the young people together and made them central in the conversation. And being a participant of that forum, I was really inspired by the incredible leadership of our young people. Their bravery too, in terms of being able to put themselves out there and talk about their experiences, and then also the wonderful ideas that they had around what we can do to take action around it. And it was at that point where I saw the community already organizing and doing something, that I thought maybe if we had a way to collect some data, that along with the stories, we can use that data to advocate for prevention programs and policies to address the big issue of gun violence. Sometimes when we hear, cries from our community about health issues that matter to them, sometimes they're not aligned with the health issues that we see from the government perspective or leading health organizations saying that this is a crisis. But in this situation, there's really a coming together of what families are asking for, what our Durham community is experiencing, and what we're seeing nationally with in terms of our gun violence problem. So I'm just gonna spend a couple minutes just sharing some statistics about what we're seeing with the gun violence. And there, Alexandra, we have a little picture of you here because this is just one of the pictures of one of our convenings with the young people in a bakery, where we also using the song. So as I mentioned, and others that introduce themselves, this is a partnership that's between Lat 19, La Semilla, a couple of units at Duke, and really at the center are really the families with a personal experience of gun violence. And we I believe have some on the call, so I'm not going to spend too much time saying what we're doing, so that we can spend some time listening from people and from you all in terms of what you all think we should be working on together as a collective. So here we can see, Alexandra mentioned her own daughter's experience with Miguelito and losing. Miguelito is one of the individuals that are represented here on these lines. But broadly, what you can see here is that from 2002 to 2022, in the last 20 years, there's been a radical shift in what is the leading cause of death among our young people. Historically, when I was a young person, motor vehicle accidents were the leading cause of death. And I actually have a very similar story as what Alexandra shared with you with her daughter, my own experience of saying goodbye to a boyfriend of mine and who passed away that very night from motor vehicle accident. Now we're seeing this happen with gun violence. And you can see that shift of that dark red line here on the right is this point where we switched over from motor vehicle accidents being the leading cause of death to really a huge spike here in terms um, of firearm violence. You can kind of see what the dates are around if you look down, and it's really around 2020 when the pandemic happened. Unfortunately, a lot of people during the pandemic, in the fear of not knowing what is going to happen, there was a lot more guns that were purchased. So the availability of guns really expanded during that time period. And these trends are mimicked in our own backyard. You look here, this is a graph showing of what we're seeing here in North Carolina. And you can see here too that there was a huge spike and a crossover in terms of gun violent deaths in North Carolina. So North Carolina, we're doing even worse than what we're doing here in the rest of the United States. So it's a huge problem for us. And then the last piece of data that I'll share is this one, because one of the reasons why we as a community here that we're particularly, our group is particularly interested and concerned about inequities in our Latino, Latina, Latinx community, and Latinos are disproportionately affected by gun violence. Here are the differences between different racial and ethnic minoritized groups, both as it comes to suicide, gun violence deaths related to suicide, and gun violence deaths related to homicides. And we can see that particularly for Latinos, the gun homicide rates are particularly disproportionately burdened by our community. So really what the goals of this project are is we're spending most of our time in this early phase of trying to develop relationships particularly with the young people and the families that have been affected by gun violence. And we're learning a lot in the developing of those relationships. This is a research project, but first and foremost, these are families that have been personally affected. And so we're learning a lot about what the immediate needs are of families and what they need in terms of being able to address the issues that they're living with today, right? And unfortunately, sometimes we can't wait to the end of a research project to be responsive to that. We also want to learn, and we're going to be collecting this data systematically around what are some of the needs, the preferences, and opportunities for us to prevent gun violence. And part of that is that, we're going to be doing focus groups, and we've been doing talking circles where we're collecting data too around what are those perceptions of what are opportunities for us to intervene. And then ultimately, with this experience of relationship building and data collection, we want to develop a roadmap of priorities and next steps that we can use as a guide to develop, implement, and test the impact of different programs and policies that are directed to prevent this issue of gun violence. So I just briefly mentioned some of the ways that the activities that we're engaged in this research project. We're conducting talking circles, and in these talking circles, we've been meeting with families that have been personally affected, and we've had a chance to share our experiences and lived experience and perspective with that. We've developed a youth advisory board. We currently have 7 members of young people between the ages of 11 to 24 that are advising us on this project and giving us ideas of what needs to be done and how we could advocate for reform. We're in the process of hiring a young person with the lived experience of being a survivor of gun violence to be part of our research team and serve as a youth research partner and be part of our meetings for planning and part of our data collection and dissemination efforts. We're doing some focus groups, and you'll hear a little bit more about that because that's one of the next things that we are planning. And then finally, at the end of the project, and this will probably be early in the new year, we're going to have a community empowerment forum where we'll bring together the young people, our research team, and other policymakers and service providers that are involved in developing services or making decisions around gun violence. and have an immediate impact to listen to the findings of our research study and brainstorm together about what we can do as a community. So this is some of the progress that we've made, and mentioned that we have pulled together a youth advisory board. We initially thought we would be meeting with them on a quarterly basis, but it's been more about like every month or every other month. There's been a lot of good engagement with this group. We've hosted about 3 talking circles with families affected since the beginning of this project, but before that, Alexandra and others had been involved in doing some of this work. And then we had this opportunity where we had a Patricia, who's a doctoral student and cannot be on the call today because she's taking one of the most important exams of her PhD program right now. So she apologizes for not being here, but she was invited to be a representative for the Duke graduate students to speak to the North Carolina Assembly. And we happened to have a meeting with the youth advisory board right before she was meeting with the assembly. And so she was able to actually share the perspective of young people directly to the North Carolina Assembly and really elevate their voice in terms of what they would like to see. So that was a wonderful opportunity. So I'm just gonna stop sharing here and just want to open it up to the community